This training is designed to provide you with an awareness of the signs of child abuse and how to report it. There are four main types of child abuse: physical abuse, neglect, emotional abuse, and sexual abuse. Physical abuse is the non-accidental physical injury of a child by a parent or caregiver. This could include punching, kicking, or beating. Physical discipline, such as spanking, is not considered abuse as long as it is reasonable and causes no bodily injury to the child. Signs of physical abuse can include unexplained bruises, burns, bites, broken bones, black eyes, fading bruises, or other marks. Physical abuse may cause a child to appear frightened of parents, protest when it is time to go home, or shrink back when an adult approaches them. A child may also report an injury caused by a parent or other adult. Neglect is the failure of a parent or caregiver to provide for basic needs of a child. Neglect can be physical, medical, educational, or emotional. Physical neglect is the failure to provide necessary food, shelter, or supervision for a child. Medical neglect is the failure to provide necessary medical or mental health treatment for a child. Educational neglect is the failure to educate or attend to special education needs of a child. Emotional neglect is the inattention to emotional needs, lack of psychological care, or permitting a child to use drugs or alcohol. Signs of neglect can include a child having frequent absences from school, begging or stealing money or food, lacking needed medical or dental care, immunizations or glasses, being constantly dirty, having severe body odor, or lacking appropriate clothing for the weather. Additional signs of neglect can be a student abusing alcohol or drugs or stating there is no one at home to provide care. Emotional abuse is a pattern of behavior that impairs a child's emotional development or sense of self-worth. This can include constant criticism, constant threats or rejections, or withholding love, support, or guidance. Emotional abuse is often difficult to prove and almost always is present when other forms of abuse are identified. Signs of emotional abuse can include extremes in behaviors such as being overly compliant or overly demanding, extremely passive or aggressive. A child displaying inappropriately adult or inappropriately infantile behaviors. Children being emotionally abused may have a delay in physical or emotional development, may have attempted suicide, or report a lack of attachment to parent. The National Center on Child Abuse and Neglect defines child sexual assault as contacts or interactions between a child and an adult when the child is being used for sexual stimulation of the perpetrator or another person. Sexual abuse has been defined to include inappropriate physical conduct, making a child view sexual acts or pornography, using a child in making pornography, or exposing an adult's genitals to a child. Signs of sexual abuse can include sexual knowledge inconsistent with the age of the child, nightmares or sleep problems, refusing to talk about a secret with an adult, painful urination or bowel movements, wetting or soiling accidents, resisting removing clothing at appropriate times, running away, drastic changes in behavior, pregnancy, or venereal disease, especially under the age of 14. There are several major risk factors for child abuse. These include parental and family structure, child, and environmental factors. Parent and family structure risk factors often include personality characteristics of the parents, such as depression, low self-esteem, anxiety, and poor impulse control. The parent's personal history of maltreatment or substance abuse, a lack of knowledge of developmental norms, for example, hitting a 1-year-old for soiling pants, high stress levels on parents due to economic worries or lack of social support, marital conflict and domestic violence, children in single-parent homes and homes with a great number of people in the house may be at greater risk for abuse. Child risk factors include the age of the child with the greatest risk between birth and 3. Teens are at the greatest risk for sexual abuse. A child with disabilities can be at great risk because they could be more vulnerable, lack understanding of abuse, and how to seek help. Environmental risk factors can include poverty and unemployment. When poverty is combined with substance abuse and/or depression, the likelihood of maltreatment can increase. Social isolation and a lack of social support for the family, as well as living in a violent community. In Texas, anyone who suspects a child is being abused or neglected has a legal obligation to report it. This means anyone, even neighbors, relatives, and friends. Educators are considered professional reporters and are required to report suspicions of abuse or neglect within 48 hours. By law, educators may not delegate their duty to report to anyone else. It is not enough to tell a principal or school counselor. You must make the report yourself. The duty to report child abuse exists even if the student is now an adult. Reports of abuse of elderly or disabled adults can be made to Adult Protective Services. In Texas, people reporting in good faith are immune to civil and criminal liability. There are 2 ways to make a report of child abuse or neglect. You can make a report by calling the Texas Department of Family and Protective Services hotline number or on their website. Do not use the online reporting method for urgent or emergency situations. A school counselor can help you make a report and gather information needed when a report is made. In conclusion, it is your professional duty to report all suspicions of child abuse or neglect. For further assistance for a child, consult with the child's school counselor.